everyone, and welcome. You are watching Eagle News America. I'm Anna Cui, coming to you from Las Vegas, Nevada. It is Sunday, December 13, 2020. Tonight we have updates from several of our correspondents across North America. Bureau Chief Ace Ramirez in Washington reports about the mRNA COVID-19 vaccine. Should you take it or not? Next, we have Bureau Chief Thomas Likeness in Edmonton, Alberta.
Meet Mr. COVID. He's Alberta's latest attempt to reach people about the dangers of socializing during the pandemic.
Andre LaJoy in Montreal, Ottawa reports about Nova Scotia and New Brunswick provinces to receive the COVID-19 vaccine. April Masong in Toronto, Ontario reports about COVID-19 vaccines by Pfizer-Biontech to arrive in Ontario this Monday. Bureau Chief Myla Simbulan in Swarthmore, Pennsylvania.
Pennsylvania is on pause for the next 3 weeks due to the overwhelming daily increase of the number of positive COVID cases.
In Las Vegas, Lori Jarvina.
Nevada now first in nation for most COVID-19 hospitalizations per capita.
Sarah Ariola in Santa Clarita, California.
Los Angeles opened city's first homekey site to provide supportive housing for 40 homeless families.
John Okuma in Los Angeles, California.
Los Angeles County surpasses 525,000 COVID-19 cases and breaks another daily high.
For today's technology news, Melissa Allen in Lakeland, Florida reports about the FCC granting Elon Musk's Spacex $885 million for Starlink satellite internet project. And for environment news, Stephanie Ward in Texas reports about San Antonio opening the largest wildlife land bridge in the U.S. First, an overview of today's COVID-19 numbers. According to the Coronavirus Resource Center of Johns Hopkins University and Medicine, as of 6 p.m. Eastern Time, Sunday, December 13, 2020, the number of cases of COVID-19 reported worldwide is now more than 72,099,000. Top three on the list of countries with recorded cases: U.S. at number 1 with 16.1 million, followed by India with 9.8 million and Brazil with 6.8 million. More than 1,610,000 lives worldwide have succumbed to this virus. Top three countries with the most number of COVID-19 related deaths are U.S. with more than 298,000, followed by Brazil with more than 181,000, and India with more than 143,000. UN Chief Antonio Guterres on Saturday urged world leaders to declare a state of climate emergency and shape greener growth after the coronavirus pandemic as he opened a summit marking 5 years since the landmark Paris Agreement. The Climate Ambition Summit being held online comes as the United Nations warns current commitments to tackle rises in global temperatures are inadequate. The UN Secretary General said in his opening address to the summit, who is co-hosted by Britain and France, the commitments made in Paris in 2015 were far from enough to limit temperature rises to 1.5 degrees Celsius. Take a look.
5 years after Paris, we are still not going in the right direction. Paris promised to limit temperature rise to as close as to 1.5 degrees as possible. But the commitments made in Paris were far from enough to get there, and even those commitments are not being met. And so, the central objective of the United Nations for 2021 is to build a truly global coalition for carbon neutrality by the middle of the century. But that promise is not enough. To make it a reality, we need meaningful cuts now to reduce global emissions by 45% by 2030 compared with 2010 levels. And this must be fully reflected in the revised and strengthened nationally determined contributions that the Paris signatories are obliged to submit well before COP26 next year in Glasgow.
British Prime Minister Boris Johnson told the climate summit that a traumatic year of pandemic was ending with the hope of vaccines coming on stream. Meanwhile, South American countries that are members of the Progress Forum for South America, or PROSUR, agreed to promote cooperation to guarantee universal access to the coronavirus vaccine, according to a declaration from the bloc's presidential summit held in Chile.
simbólica.
Que apenas el Instituto de Salud Público en Chile apruebe la vacuna, vamos a poder iniciar el proceso de vacunación de la población de riesgo en primera instancia y de toda la población objetivo después. Y esto es fruto de un trabajo de meses, que lo hemos coordinado permanentemente con el presidente Duque, de llegar a acuerdos. La vacunación también nos va a facilitar otros desafíos que tendremos que enfrentar el año 2021, como la recuperación de los empleos perdidos, la reactivación de nuestra economía, el fortalecimiento de la red de protección social.
Now let's head over to the nation's capital, Washington. Bureau Chief Ace Ramirez shares with us information about the mRNA COVID-19 vaccine. Ace?
Thank you, Anna. mRNA vaccine, should we take it or not? With the expected rollout of the COVID-19 vaccine in the US this week, the huge question looming in the mind of the people is, should I take it or not? Let's do a quick Vaccine 101. What's a vaccine? According to the Maryland Department of Health, in conjunction with the Center for Disease Control, a COVID vaccine is one way to prevent serious illness due to COVID-19. The vaccine causes your body to create antibodies without getting sick with the COVID-19 disease. You've probably heard this before, mRNA, or messenger ribonucleic acid vaccine technology. That is something new, but it's not unknown. They've been studied for more than a decade. This technology is what the COVID-19 vaccine is using. It tricks the body into making the viral protein, which triggers an immune response to the virus that causes COVID-19. According to a report by the Horizon, a European Union research and innovation magazine, human trials of cancer vaccines using the same mRNA technology have been taking place since at least 2011. mRNA can most easily be described as instructions for the cell on how to make a piece of the spike protein that is unique to SARS-CoV-2. Since only part of the protein is made, it does not do any harm to the person vaccinated, but it is antigenic, meaning it stimulates an immune response. mRNA vaccines do not contain a live virus and do not carry a risk of causing disease in the vaccinated person. They carry no risk of causing disease in the person vaccinated. Now, the question one would ask would be, why do I need it? I'm wearing a mask, I do social distancing, why do I need to be vaccinated? The Maryland Department of Health encourages having vaccinated because stopping a pandemic requires using all the tools available. Yes, covering your mouth and nose with a mask and staying at least 6 feet away from others help reduce your chance of being exposed to the virus or spreading it to others. But the vaccines work with your immune system, so your body will be ready to fight the virus if you are exposed. Together, COVID-19 vaccination and following CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. A lot are worried, are they safe? Although the development of the mRNA vaccine can be considered at record warp speed of less than a year, the U.S. vaccine safety system ensures that all vaccines are as safe as possible. They undergo numerous rigorous clinical trials using thousands of study participants to generate data and other information for the Food and Drug Administration to determine their safety and effectiveness before approval or authorized for emergency use. Following approval or authorization, safety monitoring systems are implemented to watch possible side effects. Now the next question would be 1 or 2. How many doses do I need? And why do I need it? The Maryland Department of Health and CDC say it depends on the type of vaccine that is administered. The coronavirus vaccines being studied are evaluating 1 or 2 doses. When giving 2 doses, they are usually given approximately 1 month apart. It's possible that some vaccines will require 1 dose, while others may require 2 doses. It's also possible that over time, additional doses of vaccine may be needed to provide continued protection. In Gaithersburg, Maryland, I'm Ace Ramirez. We live in interesting times.
Thank you, Ace. Who are the priorities to receive the vaccine?
Good question, Anna. The Advisory Committee on Immunization Practices, or ACIP, and other experts will provide recommendations on priority groups and when groups should be vaccinated. Guidance on determining and providing the vaccine to priority groups will be based on the principles included in the Center for Disease Control. Visit the CDC's website for more information about ensuring the safety of COVID-19 vaccines in the U.S., including information about specific vaccine monitoring systems. As we speak, Moderna, one of the big pharmas, has confirmed that the following supply agreements have committed orders to the U.S. 200 million doses with option for an additional 300 million doses. Back to you, Anna.
Thank you, Ace, for all those good information. Now, when we come back, updates from our Eagle News correspondents in Canada, including Edmonton, Alberta, Montreal, Ottawa, and Toronto, Ontario. This is Eagle News America. Stay with us.
Hello there. Imagine Demi got the virus, and she infected 2 more. And those 2 infected a lot more of people. And it goes on and on until it became an epidemic. But what if Demi stayed at home? Then those 2 wouldn't have contracted the virus. Then those people would have not been infected. This is not just your battle, it's everyone's. And you can be a huge help. Follow social distancing, or better yet, stay at home.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
It's time to take one step further and face the impossible. Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
You are watching Eagle News America. I'm Anna Cui in Las Vegas. In an attempt to get the attention of Albertans and reiterate the danger of us spreading the coronavirus faster during parties, an ad campaign introduces Mr. COVID. In Edmonton, Bureau Chief Thomas Likeness joins us tonight. Thomas, tell us about Mr. COVID. Who is he?
Well, thank you, Anna. He's a scary-looking creature, too. Public health officials in my province hoping that injection of humor just might get the attention of people who are not listening to the messages about the pandemic. Let's bring him up here on the screen. This is Mr. COVID. He loves parties. He's the star of an ad campaign. Look at him there. Just scary as can be. He's the star of an ad campaign aimed at the 20 to 39-year-old age group, and the campaign features videos and a website. Well, what's his shtick? Basically, he does everything you shouldn't do. No mask, no social distancing. He shares food and drink, all of the no-nos. That's Mr. COVID. Chief Medical Officer of Health, Dr. Dina Hinshaw, says the province's more serious ads just didn't seem to be getting through to younger people.
We looked at a variety of options, and as you know, we have been working very hard, as I've said, over the past few months to think about what options we might have to reach out to Albertans, particularly in that 20 to 39-year-old age group, where we do see a large number of our cases. We know that Albertans in that age group are at the lowest personal risk of potentially having severe outcomes. However, they also, unfortunately, can spread the virus to others and be a part of that onward rising of the curve. And so we wanted to find an option that could effectively reach.
Now, the videos target two typical situations: family gatherings and house parties. Hinshaw says the videos demonstrate why it's important to avoid social gatherings at this time.
Our goal is to get people's attention, to help them see common situations from a different perspective, and as a result, to influence their behavior.
Now, these ads were shot last month. Hinshaw says safety was a top priority during the shoot.
The cast and crew were required to follow these strict protocols, including screening, off-camera masking, and distancing at all times when the camera wasn't rolling.
As well as broadcast, the videos are on a website called covidloves.ca. This website also features a slideshow of people that COVID would love to meet and, of course, infect. And there's a misinformation section that dispels some of the common myths about coronavirus. Remember, nobody loves a party more than COVID. So govern yourselves accordingly. And while we fight this pandemic together, I wish you all good health. Remember to take care of others, take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Thomas. Well, that certainly is a different angle. How effective do you think this will be?
Well, it's hard to say. You know, it's certainly going to get people's attention, and marketing experts tell us that humor can be an effective approach. It loosens people up. It makes them a little more receptive to your message, a little bit less defensive when they don't feel like you're hectoring them, they're lecturing them, scolding them. It just loosens them up. But you see, the bigger problem is reaching the people who are set in their ways. They're not going to be swayed by ads. We have to get people over the idea that having a family gathering during the holidays, having people over New Year's Eve with, close friends and family is harmless, because clearly that's just not the case. The majority of new cases of COVID, well, they come from these kind of gatherings. And as harmless as our friends, our family, as harmless as grandma, grandpa, your cousins may seem, at this time we have to assume everyone we come into contact with is infected. Anna?
Yes, exactly. I mean, this has been our narrative here in the last couple of weeks, since the Thanksgiving weekend, right? With the people gathering for family gatherings. Hopefully, this ad will be effective to some. I think people just gotten used to seeing the same things over and over again, and something different, maybe it'll catch their attention. I'm wondering, Thomas, how much did this campaign cost?
Well, the price tag on this is about $2 million, and to you and I, that seems like a lot of money. This also includes, incidentally, the time buy for broadcast. Is the money well spent? Well, as Dr. Hinshaw says, it's another tool in the toolbox to reach people. And in the scheme of things, when you're talking running a big health department, $2 million is not a lot of money. Hannah?
Yes, exactly. Well, good luck to them. Hopefully, it will reach some people. Thank you,
Anna,
Thomas,
stay
for joining us
safe.
tonight.
Okay, take care.
Yes, stay safe. In Montreal, Eagle News correspondent Andre Lajoie reports about the arrival of the COVID-19 vaccine in the provinces of Nova Scotia and New Brunswick, and who are slated to receive them first. Andre?
Bonjour tout le monde. Good morning, everyone. According to the government of Nova Scotia, the province will be receiving 1,950 doses of Pfizer-Biontech vaccine, and healthcare workers will be immunized first, including those working in COVID-19 care units, regional care units, and intensive care units carrying the COVID-19 patients. According to the Premier of Nova Scotia, Premier Stephen McNeil, the rollout will be gradual based on the vaccine supply and wants to make sure that the most vulnerable population are protected. Furthermore, the focus of the province is the central zone, which are the Halifax area, Eastern Shore, and West Hat. For this December, as the vaccine strict storage handling and shipping requirements, the vaccine cannot be moved around. Moderna vaccine are also expected to arrive this month. The province focused for the first 3 months of 2021 following the National Advisory Committee, the NACI guidelines of COVID-19 vaccines are long-term care resident and staff, seniors who live in the community beginning with those who are over 80 years of age, then people over 75, and then people over 70. Healthcare workers directly involved in patient care as well. In New Brunswick, according to the Director of New Brunswick Emergency Measures of Organizations, Greg McMillan, the province will be receiving 1,950 doses of COVID-19 vaccine as well. According to the Government of New Brunswick, a detailed vaccine plan is being done. Priority groups who will receive the vaccine has been set on. Those groups are long-term care resident and staff from provincial rapid outbreak management teams who respond to COVID-19 breaks, extramural ambulance New Brunswick staff, healthcare workers, First Nation nurse, and seniors 85 and older. Reporting from Ottawa, Canada, this is Andre Nashua. We live an interesting time.
Thank you, Andre, for that report. In related news, tomorrow, the province of Ontario will receive its first shipment of the COVID-19 vaccine. In Toronto, April Masongsong reports.
Premier Ford announced Friday that the Pfizer-Biontech COVID-19 vaccines will be arriving in Ontario this coming Monday, and the first vaccines will be administered on Tuesday, December 15th. Here is General Rick Hillier, head of the COVID-19 vaccination task force, with more details.
Last night I had the opportunity to talk to the heads and some of the teams at both of those sites, and they are ready. There is an anticipation here that this is the light at the end of the tunnel, and we are ready to commence with it. 3,000 doses of the vaccine will arrive in Ontario here. We believe on Monday, but by Monday, 3,000 will remain here in Toronto, 3,000 will be in Ottawa, and out of that we will vaccinate some 1,500 people in each site.
2 locations have been chosen to receive the vaccine first: the University Health Network here in Toronto and the Ottawa Hospital. More than 2,500 healthcare workers on these 2 sites are set to receive the vaccine, especially those working in long-term care homes and critical care units. There is also a concern as to how the task force will be choosing which long-term care home and which healthcare workers to vaccinate first. Here is the General's response.
It's actually data-driven in the extreme. We've walked through this many times in the last days. However, what we are doing is looking at the long-term care homes that have had COVID-19 so tragically visited upon them, or where they've had challenges and tragedies before, where there is communal living, that is to say a shared kitchen, where there is more than one person sharing a room, and long-term care homes where the provinces had to intervene. Those became the first in the order of priority.
When asked about the specific logistics on how the vaccine will reach Canada and the concerns that the U.S. might try to stop them from coming into the country, here is what General Hillier had to say.
We expect the vaccines to arrive on Monday. If they should arrive earlier, we are going to be prepared to pick them up. They are going to arrive at Pearson. We have thought about them moving through the United States from Belgium into Germany, through the United States into Canada, and realize we cannot control what happens from there. So Pfizer has said that they're going to deliver to us by Monday. We've done our planning, our work to be ready for them before that. And then because we expected them on Monday and still do, we are ready to start vaccinations on Tuesday.
In total, this month of December, Ontario is expecting 90,000 Pfizer-Biontech vaccine doses from the federal government and will be delivered to about 14 hospital sites throughout the regions considered as COVID-19 hotspots in the province. On Friday, Ontario reported 1,848 new cases of COVID-19 and recorded its highest number of deaths in a day. 45 people died of COVID-19 in the last 24 hours. 29 of those who died were residents in a long-term care home. In Toronto, April Masongsong, Eagle News. We live in interesting times.
Thank you, April. When we come back, updates from our Eagle News correspondents in Swarthmore, Pennsylvania, Las Vegas, Nevada, and Santa Clarita, California. This is Eagle News America. Stay with us.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced. Not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A one-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to explain our health outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Gusto namin maging happy ang mga viewers sa amin pagpapatawa, sa amin pag-entertain, iba-ibang segments and games.
Rumarampa! Lumalagpas! Lumarampa!
Mamasan? Batanes! Mamamas? Batanes!
The jackpot prize of 58,000 pesos ang tamang sagot na hinahanap natin.
3, 2, 1!
Happy peeps, on the Happy Time stage, please welcome...
Magandang dilag sa isip mo naman mo.
Thank you po.
Ay, maraming salamat po.
Taos-puso po kami nagpapasalamat sa malaking tulong na inabot niyo po sa amin.
Please watch Happy Time every day, Monday to Friday, dito lang sa Net25.
Happy time, happy time, happy.
This is Eagle News America. I'm Anna Cui. Overwhelmed by the daily increase of COVID-19 cases, the state of Pennsylvania will be on pause for almost a month. In Swarthmore, Bureau Chief Myla Simbulan is with us tonight. Myla?
That's right, Anna. Pennsylvania's COVID-19 cases continue to rise. Governor Tom Wolf and Secretary of Health Dr. Rachel Levine implored Pennsylvanians to take the next 3 weeks and stand united against the virus by adhering to existing mitigation orders and stricter efforts. Here's Pennsylvania Governor Tom Wolf with this announcement. He's actually in quarantine right now in his home because he recently tested positive for COVID-19. Take a look.
So today I'm announcing additional temporary COVID-19 protective mitigation measures in the Commonwealth. The measures go into effect on Saturday, December 12th. at 12:01 a.m. Friday into Saturday, and they expired Monday, January 4th at 8 a.m. With these measures in place, I hope that we accomplish three goals. First, I want to stop the devastating spread of COVID-19. Second, I want to keep our hospitals and our healthcare workers from becoming overwhelmed. As Dr. DeFlitch said, we're now in the 9th or 10th month of this pandemic. People are really tired. We're all tired. But our healthcare workers, above all, are really, really tired. And we want to make sure that we keep them from being overwhelmed. The third thing is to help Pennsylvanians get through the holiday season and closer to a widely available vaccine, that is the light at the end of the tunnel, as safely as possible. This is a bridge to that better future that we all know we can get to in Pennsylvania.
The order provisions are accompanied by supportive data used in part to make these decisions. The data provides a sampling of research that supports why limiting gatherings, reducing occupancy, and temporarily suspending some activities, among other efforts, are considered vital to stopping the spread of COVID-19. Two recent studies, one by Yale University and one by Stanford University, substantiate more than one of these mitigation efforts. Here's a summary of the new mitigation orders. All in-person indoor dining at businesses in the retail food services industry, including but not limited to bars, restaurants, breweries, wineries, distilleries, social clubs, and private catered events, is prohibited. Outdoor dining, takeout food service, and takeout alcohol sales are permitted and may continue, subject to any limitations or restrictions imposed by Pennsylvania law. Indoor gatherings and events of more than 10 persons are prohibited, but churches, synagogues, temples, mosques, and other places of congregate worship are specifically excluded from the limitations set forth during services. These institutions are strongly encouraged to find alternative methods for worship, as in-person gatherings pose a significant risk to participants at this time. Indoor operations at gyms and fitness facilities are prohibited. Outdoor facilities and outdoor classes can continue, but all participants must wear face coverings. All sports at K-12 public schools, non-public schools, private schools and club, travel, recreational, intramural, and intramural sports are paused. Here's Professor at York College of Pennsylvania and virologist Dr. Mida Higa to give us some insight on how virus such as COVID-19 spread and why mask and social distancing is important. Take a look.
The data regarding virus spread indoors is well studied and clear. In closed spaces, in areas where people are less than 6 feet apart, and in areas of poor ventilation of outside fresh air, time and time again, we see virus transmission. The outcomes are worse if we are singing or cheering, like at a sporting event, or breathing heavily, like we might do working out. In these studies, and there are many, transmission is seen between individuals with no contact, such as passengers on a bus or restaurant patrons at adjacent tables. In the restaurant study, 50% of people dining at the same table as the infected individual were positive within 7 days. At an adjacent table, 75% were infected. In a meat processing plant, the infected person transmitted the virus to a colleague working more than 26 feet away over 3 consecutive working days. In that situation, low temperatures combined with recirculation of inside air throughout the hall, combined with the high physical workload of workers with heavy breathing, were suggested as factors that enabled transmission over longer distances.
So there is a light at the end of the tunnel because a vaccine will soon be available, but it will still take several months before we see that light. In Smart for Pennsylvania, Myla Simbulan, Eagle News, we'll live in interesting times. Back to you, Anna.
Thank you, Myla. So the pause started yesterday what can you tell us about the people's reactions regarding those new mitigation orders?
Anna, it was truly an interesting weekend. Some people are frustrated. Others are tired, especially the healthcare workers. But the most affected are small business owners, such as restaurant owners, since many will be out of work during the holidays. Actually, we have a reservation by the end of the month for our wedding anniversary, and we have no choice but to cancel it. And I've heard that others, there's a gym owner who's now planning to close. He said it still continue, and some restaurant owners as well are planning to still continue opening their restaurants. Anna?
Well, thank you, Myla. Hang in there. I'm sure you'll find another way to celebrate your wedding anniversary. Stay safe.
Thank you. You too.
Now on to more overwhelming news. The state of Nevada has now been reported first in the U.S. with the most number of COVID-19 hospitalizations per capita. In Las Vegas, Eagle News correspondent Lori Jarvina reports. Lori?
Thank you, Anna. According to the Nevada Hospital Association, there were 1,824 people hospitalized as of last Wednesday, up from the 1,645 the previous week, and significantly up from the recent low of 417 on September 12th. As of Wednesday, Nevada hospitals were at 82% capacity for staffed hospital beds and 73% of ICU beds were occupied. According to the Nevada Independent, Nevada now has the highest number of people hospitalized per capita of any state, amounting to 59 people per 100,000 residents, surpassing South Dakota, which last week was leading the nation in COVID-19 hospitalizations with 57 people hospitalized per 100,000 residents. Capacity is a real danger, as one chief clinical officer confirmed that they have had to transfer some patients in their facilities to out-of-state locations such as Colorado and Arizona. Rural areas in Nevada are also facing the same space shortages for patients, noting that they don't have large parking garages to set up alternate care sites, like the renowned Regional Medical Center in Reno that also made headlines recently. In the meantime, Nevada is nearing completion of a 3-week statewide pause that began right before the Thanksgiving holiday. Some of the increased restrictions included reducing restaurant capacity from 50% to 25% and limiting all gatherings to no more than 10 people from 2 households. In the next few days, the Nevada governor will reassess and determine whether he will impose additional measures, including a prohibition on indoor dining and closing gyms and fitness facilities. Meanwhile, the Nevada COVID-19 Mitigation and Management Task Force held their weekly meeting on Thursday, December 10th, with some positive updates. Nevadans are scoring high marks when it comes to compliance of state mandates. Let's listen in to the Zoom meeting with Director Terry Reynolds from the Department of Business and Industry.
This is Terry Reynolds for the record. Just to go over kind of quickly in terms of observations for the last couple of weeks, we're seeing actually very good compliance. We're also seeing a high degree of increase in complaints, which tells me that people are, employers, employees are cognizant of what the rules are and what they should be doing. So, and we're going and following up on those complaints. Really, we're seeing just kind of one-off areas where people are not complying with their employees or people in certain areas, certain stores. But other than that, generally the compliance is pretty good.
Reynolds went on to say that any youth and adult sports events are doing a fairly good job with staying below the 50-person maximum for gatherings or not having any spectators at all. According to the Gaming Control Department, surprise inspections to several small business establishments had favorable results, with only one maskless person reported amongst thousands of employees and customers that were observed. Nevada also still has 90 federal grants amounting to $128.9 million for small businesses. And as for PPE, the state is maintaining an overall stockpile of 120 days worth. and receiving supplements regularly. More good news. We've all heard that the FDA approved the emergency use of Pfizer and BioNTech's COVID vaccine on Saturday. So as the state of Nevada eagerly awaits to begin vaccinating frontline workers, Governor Sisolak cautions Nevadans, the fight is not yet over. Wear your mask and practice social distancing. In Las Vegas, Nevada, Lori Jaravina, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Lori, for that report. Now, quickly, how do you feel about taking the vaccine?
We've been thinking about that and talking about it a lot in our family. And, even though we have heard and read that maybe results of the vaccine won't be seen or acknowledged until maybe 3 years after, our family is on board. And we'll definitely trust in the medical experts that the vaccine will do what it's intended to do. Back to you, Anna.
Thank you, Lori. Thank you for joining us, and stay safe. Now let's shift gears with some good news. In Los Angeles, the city's first homekey site opens for 40 homeless families. Sarah Ariola reports. Sarah?
Thank you, Anna. Los Angeles opened city's first homekey site to provide supportive housing for 40 homeless families. Homekey is the next stage succeeding project Roomkey. It continues the goal to provide shelter to those who are homeless as they are more at risk of exposure and infection from COVID-19. The Housing Authority of the City of Los Angeles, or the HACLA for short, collaborates with the LA Family Housing to welcome the first Homekey site, which is the new apartment building called Parthenia Place in the Valley Area City of Council, District 6. This homekey site features 40 apartment units to offer more long-term housing to homeless families, bringing them indoors where they are safe from the virus. Los Angeles Mayor Eric Garcetti states, "Our neighbors sleeping on the streets face a heightened risk of exposure to illness and death, and this pandemic has added another measure of danger and threat to their health and lives." Parthenia Place is exactly what our state had in mind when it launched Homekey, a safe permanent home for our most vulnerable Angelenos, a place where they can shed the burden of finding somewhere to rest their heads and focus on keeping themselves, their families, and our communities healthy. The HACLA and the LAFH will support these family shelters in Parthenia Place and provide the onset support assistance and services needed for them to maintain permanent housing. Stephanie Klasky-Gamer, LAFH President and CEO, says, "We are in unprecedented times, with far too many Angelenos without work, facing dwindling unemployment benefits and rents they can no longer afford. The already staggering rate of homelessness in our city will without question increase. Through Homekey, LA Family Housing is poised to meet the growing need for safe and stable interim and permanent supportive housing for our city's most vulnerable residents." In Santa Clarita, California, Sarah Ariola, Eagle News. I tell you, we live in interesting times. Back to you, Anna.
Thank you, Sarah, for that good news. Now, I know there's cost for everything, so can you tell us where will the funding come from for this project?
Yes, these are stellar news from Los Angeles, as the city has increased 16.1% in the homelessness since last year, according to the 2020 Greater Los Angeles Homeless Count. So the opening of the Parthenia Place to shelter 40 homeless families will greatly help in the city's homelessness crisis amid the pandemic. Parthenia Place will be the first from a plan of 15 properties, which includes 2 motels that will offer more than 750 rooms. The City Council and the District 6 are already committed to $200 million for the CARE Act's funding for these various Homekey projects. Anna?
That's great to hear, Sarah. So there will be more other properties then. Thank you so much for this report, and thank you for joining us. Stay safe.
Thank you.
When we come back, more reports from Los Angeles, California, Lakeland, Florida, and San Antonio, Texas. This is Eagle News America. Stay with us.
It says the best defense is still containment.
We are in uncharted territory.
Final volume 42K.
tayo on to 100%. Traffic ban. Construction eh.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business every Saturday from 5 to 6 p.m. Open for Business, from vision to action.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
You are watching Eagle News America. I'm Anna Cui in Las Vegas. Los Angeles sets another COVID-19 daily high record with the number of positive cases surpassing 525,000. Eagle News correspondent John Okuma with the details. John?
Thank you, Anna. Los Angeles surpasses 525,000 COVID-19 cases in the county and breaking another daily high in positive cases last Friday. According to Los Angeles County Department of Public Health, there are more than 500,000 positive coronavirus cases. It was November 30th when Los Angeles County exceeded 400,000 positive cases, in addition of 100,000 new cases in just 2 weeks. There are also 2,185 people in Los Angeles due to COVID-19 on this day, but today, those numbers almost doubled. The Los Angeles also saw a daily high record of cases, once again breaking last Friday with 13,815 new COVID cases. A month ago, in November 2nd, 134 positive cases was a 5-day average, but now the 5-day average of COVID-19 cases is an alarming 10,034. 12 deaths was the average 5-day, but now the 5-day average is 62. The county is experiencing a rise of 370% in positive COVID-19 cases, 416% of COVID death, and 303% in COVID-19 hospitalization, all within 1 month period. Barbara Ferreira, a Los Angeles Public Health Director, states, "This is extraordinary challenging times. Hospitals are stressed and filling up to 100 of new COVID-19 positive patients each day. Our healthcare workers are exhausted and deaths are reaching an all-time high. Taking action by each of us to continue to make a break an all-time high. Action taken by us to make it or break it, our collective ability to prevent many people from becoming infected, seriously ill, and potential passing away from COVID-19. While vaccines are around the corner, they will not be here in time to prevent compromising care for seriously ill individuals of our hospital. Los Angeles residents are urged to strictly follow instructions. from public health officials. Everyone needs to stay home as much as possible, except for essential work and services. Face covering must be worn outside and be worn each time you are together with people not in your household. You are at high risk of exposure and infecting by the coronavirus. In Los Angeles, California, John Akuma, Eagle News, we live in interesting times.
Thank you, John, for that report. It certainly is overwhelming, and the vaccine can't come soon enough. Now, what are the current COVID-19 statistics there today?
Anna, the COVID-19 statistics had just reached about 3 hours ago, and not as high as last Friday's number, but they continue to be dismal. The Los Angeles Public Health Department records of 12,731 new cases and 29 new deaths are another record-breaking 409 current hospitalizations. To date, Los Angeles County has now the total of 486 positive cases and 8,298 deaths. Anna?
Well, thank you, John, for your report, and stay safe out there.
You too.
In technology, everyone is always trying to build things that will go faster. Faster cars, computers, phones, and yes, even what everyone can't live without these days, the internet. Now, aerospace company Spacex has just received subsidies from the FCC that will help give internet access to everyone at blazing speeds. Melissa Allen has the story. Melissa?
In technology news, on December 7th, American aerospace company SpaceX was granted more than $885 million in FCC subsidies for their Starlink satellite internet project, whose initial aim is to provide low-latency, high-speed broadband internet to rural and underserved areas in the U.S. and eventually throughout the world. Late last month, SpaceX launched its 16th Starlink mission, in which 60 communications satellites were carried up into orbit from the Cape Canaveral Air Force Station in Florida, utilizing a reusable Falcon 9 rocket. The project is currently undergoing its public beta testing phase. Beta testers have posted photos and videos of their Starlink kits and installations on social media, and some have remarked about the technology's impressive speed test results. One Twitter user posted receiving download speeds in the triple digits. SpaceX founder and CEO Elon Musk touted the kit as installer-friendly and tweeted, quote, "It takes about 5 minutes to set up, but with future improvements, probably less than 3 minutes. No technical knowledge needed. Just point at open sky and plug in," end quote. SpaceX plans to send thousands of Starlink satellites into the Earth's lower orbit. For the millions of rural Americans currently lacking internet access, this may soon be able to help bridge the digital divide. In Lakeland, Florida, Melissa Allen, Eagle News, we live in interesting times.
San Antonio opens the nation's largest wildlife land bridge. Eagle News correspondent Stephanie Ward files this report.
Thank you, and howdy from the Lone Star State. The city of San Antonio is encouraging residents to go out to their local parks and trails to enjoy nature while practicing social distancing. On Thursday, former San Antonio Mayor Phil Hardberger announced the opening of the Robert L. B. Tobin Land Bridge Friday, December 11, and invites the whole community to walk across it. The land bridge is uniquely designed for safe passage by both humans and animals, and is currently the largest wildlife crossing constructed in the United States. The land bridge reclaims the natural habitat above Wurzbach Parkway and connects the previously split halves of the 330-acre Phil Hardberger Park located on north central San Antonio. This land bridge was funded through private donations as well as the voter-approved City of San Antonio 2017 to 2022 bond program. According to National Geographic, Land bridges such as these, which reconnect fractured habitats and promote wildlife crossings, have been proven to reduce wildlife vehicle crashes around the globe significantly. In the coming years, Robert L.B. Tobin Land Bridge aims to serve as a living classroom for research and to foster community engagement. Former Mayor Phil Hardberger expressed his gratitude for the community support of this land bridge.
Good morning, I'm Phil Hardberger. I'm standing on the Robert Tobin Bridge at Hardberger Park. It is officially open today. Welcome all of San Antonio.
Hi, I'm Mayor Ron Nirenberg, and I'm honored to invite you to the opening of the brand new Robert L.B. Tobin Land Bridge at Phil Hardberger Park. This is the largest urban park in the city of San Antonio since the 1800s. It's right in the heart of the city.
This bridge is unique in the United States. You won't see another one. It is 2/3 of a football field long and wide, goes across 8 lanes of traffic, 6 now, 2 coming. There are certainly plenty of bridges, but about 95% of bridges are for people only, almost none for animals and people. So I think you're going to see something you'll never see anywhere else in the United States.
A vision turned to reality after a decade of work. This unique land bridge is now an icon in our city and unites the two sides of Phil Hardberger Park.
Because of COVID-19, formal opening ceremonies and celebrations have been canceled. Park visitors should wear masks and maintain at least 6 feet of distance from individuals outside of their household while at the park. In San Antonio, Texas, I'm Stephanie Ward, Eagle News. We live in interesting times. Back to you in the studio.
Thank you, Stephanie. And as we end this episode, we continue to thank our healthcare workers, first responders, and essential workers with a round of applause. We continue to appreciate each and every one of you. That is today's Eagle News America. Thank you for joining us. I'm Anna Cui, and we live in interesting times.